Health care is an issue that a lot of Kentucky voters have ranked high on their list of concerns this November. In our WKYT survey, it ranked 6th out of the issues like cost of living, crime, and election integrity. Well, WKYT's Kristen Kennedy takes a closer look at health care and why it's so important to Kentuckians this election season.
In our survey, Kentucky voters put health care concerns ahead of education and foreign policy. When it comes to health care access, a lot has changed in the last 4 years. Dr. Joseph Benitez is a University of Kentucky professor and a health economist studying Medicaid. He says the state was already making progress expanding health care options before the pandemic.
There were some policies that were already in place that allowed for Kentucky to stabilize access compared to some others. So Kentucky, we have expanded Medicaid. So Kentucky expanded Medicaid under the Affordable Care Act, and at present now it's one of among the 41 states who have.
In the last 4 years, he says Kentucky has been able to focus on expansion of much needed services like telehealth. He says investments in high-speed internet are helping too.
Seeing that there's being these investments made for telehealth, especially over the past few years, can be really promising for people who are geographically isolated, live in places that are medically underserved.
The Cabinet for Health and Family Services says about 1.4 million Kentuckians, a third of the state, is enrolled in Medicaid. Compared to our neighbors, Benitez says that Kentuckians aren't paying as much in out-of-pocket health expenses. But he does believe there's still progress to be made. For WKYT Investigates, I'm Kristen Kennedy.